It's Mari McInerney from Croaky here, and I'm speaking to Jacinta at the World Indigenous Cancer Conference. Would you be able to introduce yourself?
Sure. So I'm a Murray from the Curry. I'm a woman from North Queensland. Strong family connections from Townsville, Palm Island, across the North Queensland communities. My grandfather came from Cloncurry, and my mum come from across Queensland really, and I'm also part South Sea Islander.
Fantastic, thanks. Now you've been in you delivered a presentation on the Australian Cancer Plan and the role of and the focus for First Nations people. What are the big takeaways from that?
Yeah, so really importantly, we've all seen more and more cancer impacting our communities, our families, and people, who we're close to. Across the last couple of years, we've seen more and more people feeling connected to somebody or being connected to somebody who's had an impact by cancer. And, as we've seen that happen, what's really become important is that cancer has become the leading cause of death for our Aboriginal and Torres Strait Islander peoples across the country. And so really over the last couple of years, what myself and others have been trying to do is help strengthen the health system's approach to thinking about how to provide care for our people. And so, of course, we've seen recently NACCHO has gotten really significant resources that are going to go out and impact on community controlled sector to help strengthen their ability to support community and their cancer experience. But at the same time, we want to also make sure that cancer services are ready to see more and more Indigenous mob. And we know that there are people who don't go to Aboriginal medical services, of course, but let's start there, and then let's also support primary healthcare outside.
And what are the barriers to that?
Oh, look, I think increasingly, the same barriers that we've dealt with every other condition, really. They're no different in this context. But what we've got, I guess, is that as we've had things like cardiovascular disease and diabetes and the other conditions that our communities have been dealing with, as those conditions start to get, handled in a better way, it creates this gap that allows the spaces of cancer to start to develop. People are starting to live a bit longer, and so people who might have diabetes also end up with cancer. People who might have really serious heart disease issues become impacted by cancer. And so this becomes a really important thing. It's not necessarily that our mob are just coming down with cancer, although there will be some, but we know that people are going to have the impact of both cancer and the other chronic diseases, and cancer is a chronic disease in that context, but also that people are going to be impacted because we're living better and longer in other conditions.
Yeah, and you talked about the consultations that went into the Australian Cancer Plan. There were 41 community consultations, and you're involved in many of them. And you also talked about how important the leadership group was. I think your point was you're not just people, you're mob.
Yeah.
How did that? Yeah, in the session on governance, what are the lessons from all of that?
Really importantly, Cancer Australia is a government agency. So, they could have just gone and developed a national cancer plan that, mentioned Aboriginal and Torres Strait Islander people and things like that. But really importantly, Cancer Australia wanted to do something for our system to help build capacity and help create that environment that understood that cancer is now becoming more and more important for our communities. And so as they approach that, what they allowed us to do was step aside, the space that we've had with them to step into a stronger sense of consultation and discussion. So myself, Gail Garvey, Professor Gail Garvey, Professor Tom Karma, Professor Lisa Wapp, there's a whole lot of people who've been at the table. Dawn Casey from the Aboriginal Medical Services, Dawn Charter, from the Aboriginal Medical Services, from NACCHO. Like, we've all been sitting around the table and part of these conversations. So Cancer Australia set up a consultation process, a discussion process, which really went for 2 years before we got to the cancer plan being launched. I mean, what's really important is that this national cancer plan, about a third of it is focused on Aboriginal and Torres Strait Islander people. It's a leading cause of death for our mob, but a third of the cancer plan really touches, impacts our mob in a specific way. And everything in the cancer plan will impact on our mob. Everything will help strengthen us in this space. But to have a third of a national plan, have a focus on Aboriginal and Torres Strait Islander people, is really important.
The CEO of Cancer Australia, Dorothy Keith, just told the session that, you talked about cultural safety being at the heart of it. And she talked about how the elimination of racism is not regarded by some as the job of health sectors, but she clearly believed it was. Is that the number one thing to manage in terms of?
Yeah, look, I mean, again, I think this is about, how do government leaders and how do service providers in mainstream start to own and build in to their business the bit of the elements of impact that will make a difference to us. So, as the CEO of Cancer Australia, she's really willing to stand and to see us nationally, not just in Cancer Australia, but nationally, see us try to have an impact on racism that impacts on Aboriginal and Torres Strait Islander people and our experiences of cancer. So I think that's just been really critical to have somebody who's willing to do that, to step up, and across all of the team in Cancer Australia, they're all stepping into that journey in a really strong way.
Fantastic. Now, just one last question, if I may. You've been in the sector for, I think, 20 plus years. Can you talk about origins of the work there in progress? Are we seeing progress?
Yeah, look, we're seeing progress. So, I started off as a medical student myself before I decided to get out of medicine, and it took me into public health, really. So over the course of my career, I've been involved in public health. I was at James Cook University, associated with the medical school up there for many years, and helped lead their work and support their work in developing Indigenous participation in the medical workforce in North Queensland, helping to strengthen the medical workforce capacity in North Queensland. I was involved in that for many years, and then about 6 years ago I left James Cook Uni and went to Monash University as a Pro Vice-Chancellor Indigenous. And really at Monash University helped set up their plan for what they're going to start to do in the cancer not in the cancer space, of course, but in the Aboriginal education space. But really what was happening in the background was Cancer Australia was starting to think about what they were going to do in this space for Aboriginal and Torres Strait Islander people. And I was the chair of the leadership group for Cancer Australia back then, and really I was the chair because I've got a personal history of cancer, right? So this year I am 22 years post my own cancer diagnosis, which was a stage 3 cancer. It wasn't a light cancer, it was a really significant cancer, and it's had an impact on me for over 2 decades now. But as a part of my academic and professional work, as well as my personal commitment, in fact, my very first university job, I must say this, was about cancer. It was working on cervical cancer and helping to promote the discussion about cervical cancer in far north Queensland. So that was my first university job many years ago. So, we've all had a commitment. All of the Aboriginal leadership group in the space have got a commitment to mob, to family, to people. It's impacted on us in a really serious way. And so, I'm not sure, I probably haven't answered the question, but, we've all been doing this work in a way that says we know it's going to keep impacting on our communities. We want to keep holding our communities as strongly as we can. And all of the work that's out there around racism and around all of those things, to have the person who's leading Cancer Australia say that she thinks racism's important, that's really important for us. How do we get other health services, health leaders to be in this space with us in a different way, particularly in 2024, after the challenges that we saw in the Australian population in 2023? Of course, we've got big challenges ahead, but there's also still lots of promise.
Fantastic, thank you. Is there anything else you'd like to say?
No, just hello to all the mob who are watching, and thank you to all the colleagues.
Fantastic, Jacinta, thank you.